A concussion is a traumatic brain injury that happens from a direct force or sometimes from an indirect force from a whiplash injury. It's basically a bruise to your brain that then causes a metabolic cascade that then results in symptoms that come on either right away or sometimes hours later.
We see all kinds of people. We see young kids that are in sports, they're just starting out in sports, and they want to get back to everything. We see people who are, professional athletes. We see people who are collegiate athletes, high school athletes. We see the working person, the person whose dog runs into their head. Anybody can get a concussion.
So the most common signs for detecting if there's a balance difficulty are the patient will let you know if they feel dizziness or if they feel unstable. And I'll often ask them, how do they feel just walking down the hall? And you can ask the parents as well, people that observe them, to see if they're a little bit unsteady on their feet. And then we'll take them through a number of physical examination tests to really test their balance on both feet, one-legged stance, on both feet together, and do that each visit and see how they do compared to the last visit. Once we detect a disturbance in balance and the vestibular system, then we'll refer patients down to the Dizziness and Balance Center and give them a referral to be able to start vestibular therapy.
As they improve, we start moving that into more functional stuff. So for the person that needs to go back to school or the person that needs to go back to sport, we start making those activities turn into a pre-return to sport or pre-return to school type activities.
We work also with aerobic exercise tolerance, and so that in that way they can be able to run again and do all of the training and drills that they need to do for the sports that they like. So it's a very comprehensive program. We look at every aspect that is affected based on the deficit that we see in the evaluation.
The most important thing in terms of recognizing a concussion is to pay attention to the symptoms after any kind of head injury. If anything is off, any kind of headache, dizziness, fogginess, make sure that the athlete will pull themselves out, and the coaches know what signs to look for. If someone gets dinged, gets their bell rung, just isn't quite right after, to get them pulled out of whatever activity that they're doing and get properly assessed. Patients get better from concussions, which is great. Vestibular therapy tends to get them better a little bit faster too, which is nice to see. It's obvious it's our goal and the patient's goal to get back to sports, get back to activities, get back to school as quickly as possible.